So exercise is the biggest promoter of neuroplasticity there is. What that means is it gives your brain everything it needs for your brain to make new neurons and new connections. The reason that our brains got bigger and created more neurons and new connections was because of our need to run long distances.
Welcome to the Exercise is Health podcast, where we're talking about exercise, health, and the interconnectedness of the two. We are your hosts, Charlie
and Julie,
and we will be coming to you every single week from our studio, Muscle Activation Schaumburg. Hey, welcome back, everybody, to the Exercise is Health podcast. We are your hosts, Charlie
and Julie,
and we are coming to you from our studio, Muscle Activation Schaumburg in Schaumburg, Illinois. Now, at Muscle Activation Schaumburg, we believe your health is your most valuable asset. Your health is one of the biggest influencers of the quality and quantity of time that you have. And while there are many aspects of health, our expertise is exercise. Exercise has been proven time and again to not only improve your health, but also increase your longevity and improve your quality of life. And if you're looking for a way to exercise consistently from the comfort of your own home, with the convenience of needing minimal equipment, then you need to check out the MAS at-home workout program. This workout program is a 75-day video-guided program that includes over 100 workouts, from resistance training workouts to cardio workouts to mobility workshops and even recovery days to make sure your body stays feeling fresh and you can continue to exercise on a regular basis. So if this is of interest to you, head to homeworkout.matschaumburg.com to learn more about this program and download your copy today. And because we know that exercise is such a big piece of the puzzle for your overall health and well-being, including the health of your brain, we are bringing you a rock star guest today, none other than Dr. Philippe Douyon. Philippe Douyon, MD, is a board-certified neurologist. He completed his residency in neurology at NYU and fellowship in clinical neurophysiology at NYP Weill Cornell Medical College. He spent 5 years as an attending neurologist, epileptologist at Northeast Regional Epilepsy Group. Dr. Douyon is the founder and CEO of the health, wellness, and technology company, the Inle BrainFit Institute, which was created to improve people's health and quality of life. Through the Inle BrainFit Institute, he has created individualized exercise regimens based on the person's medical and neurological needs, as well as their personal goals. Dr. Douyon's BrainFit app, released in November 2018, is a game designed to teach people about the impact of food and exercise on the brain and body. Dr. Douyon is also the author of the book Neuroplasticity, Your Brain's Superpower, which speaks to the brain's ability to learn, adapt, and heal. In the book, he discusses actionable steps that we can all take to maintain a healthy brain. Dr. Douyon has taught his book on the online platform mentorbox.com and has traveled the United States giving talks ranging from neurological disorders to ways that we can maximize our neurological potential. Dr. Douyon is a creator and instructor of the online class, Take Charge of Your Brain in 30 Days.
Well, Dr. Douyon, thank you so much for joining us and welcome to our show.
Thank you for having me. I'm looking forward to this conversation.
Yeah, as are we. So tell us more about yourself. How did you get into medicine? What were your early academic interests and how did those lead you into your expertise today?
So I always knew that I wanted to be a neurologist, believe it or not. And I knew it because when I was younger, I had a cousin who had epilepsy, and then I had a grandmother who had Alzheimer's. And although those are two really devastating neurological illnesses, I always found something really interesting about when somebody's got a neurological disorder. It's very different than any other disorder, right? Because if there's something going wrong with your brain, it influences every aspect of your life. It influences you physically, because you might be weak on one side, you might have difficulty speaking. It has a negative impact emotionally, cognitively, mentally. So it has the ability to influence just every aspect of your life. And it made me really realize how important the brain is. And so went off to college and actually went off to college on a tennis scholarship.
Awesome.
And then, so I grew up playing and competing in tennis. And then within the first couple of weeks, you usually go for like a physical. And when I went for my physical, they found something abnormal. And it turned out, and initially they weren't sure. So initially they didn't clear me to play for the first couple of weeks. But then we had this major tennis tournament happening. And so they finally cleared me so I could go play. And I go play this tennis tournament, and I'm playing, I think, my second match of the day. And I go to serve, and all of a sudden my entire body just locks up and I cannot move.
Whoa.
And I collapse to the ground, right?
Whoa.
And I'm on the ground and I literally cannot move.
Whoa.
And so I had to default the match, but because I couldn't move and they really couldn't do anything with me, they literally just carried me to the back fence, let me lay there for an hour, and put another match on my court, right?
What?
Oh
And
my
then finally
gosh.
they were like, well, I guess there's something really wrong with him. Let's call the ambulance. And I was taken to the hospital. And it turned out that I was actually in kidney failure.
What?
And so I went through college in kidney failure, went through medical school in kidney failure. And then 8 days after graduating from medical school, after, walking on the stage at Carnegie Hall to get my diploma, I walked into an operating room at New York Presbyterian Columbia to have a kidney transplant. And my dad was my donor.
Oh my gosh.
Wow. What a
And
story.
so, yeah, and there's a really good chance that we wouldn't have caught it when we did, if it wasn't for sports and having to undergo a physical.
Sure.
And being physically active kept me strong during college and medical school. But then I also used it as sort of my way to rehab afterwards, right? Because I was like 40 pounds underweight after having the surgery. And so I had to build everything back up. And I used playing tennis and physical activity in order to do that. And so, went on to complete my training, did internship, residency, and fellowship, and became an attending. And the thing that always struck me is that even as a neurologist, right, most of the neurological disorders that I see wasn't because of some primary brain problem happening that was occurring in the brain. It was because of the impact that preventable chronic diseases was having on the brain. So the impact that things like high blood pressure, diabetes was having on the brain, right? And always felt like, well, it's got to be much more we can do than just keep giving people pills to pop.
Sure.
Yeah.
Because that wasn't solving anything, right? If anything, it was just masking symptoms, and then it would come back. You have to increase dosages. You got to manage side effects.
Sure.
I really just started studying about the impact of everything that we do on a daily basis and how that influences the evolution of our brains and the health of our brains.
Wow. That is fascinating.
So I love that you brought up, and I think this obviously will be a big topic that we'll be exploring, but how there are like chronically developing things in our body. You mentioned things like high blood pressure, and then I think you mentioned insulin resistance, or was it high
diabetes? Yeah.
Diabetes, yeah. So, and how that impacts the brain. And I have to say, I'm in the health field. I've been in the health field for like 10 years. We try to be decently well-rounded in other things other than just the muscle system. But I have to say that was kind of new news for me, because I've always related like high blood pressure, diabetes, not really to brain health. Like I didn't think, I wouldn't think that affects your brain. Is that pretty common knowledge in the medical world? Or is that also like being newly shared and newly discovered in the medical world as well?
Yeah, so I don't know if I can speak for other specialties. And I will say this, we've learned more about the brain in the last 10 or 20 years than we have the previous 200 years. But what we see every single day, somebody who's got longstanding high blood pressure and diabetes and they think that they're well controlled, I can do a CAT scan or an MRI of their brain and see the damage that it's doing.
Wow.
And in fact, when we look at over the last 3 decades and you look at the diseases that have really increased, you're looking at sedentary lifestyle, obesity, diabetes, and Alzheimer's disease. And you've got neurologists and neuroscientists that will tell you that there's such a close association between type 2 diabetes and Alzheimer's that some of us really consider Alzheimer's disease to be type 3 diabetes.
Interesting.
Right?
Very
They're
interesting.
just so linked.
Yeah.
Wow, very interesting.
And I love that he just labeled inactivity as one of the very common diseases.
Exactly.
Because it really is.
Yes,
it
really is. And I don't know if you guys have ever been diving.
Oh, like diving? No, I haven't.
I've been scuba diving once. I probably will never do it again.
Okay.
But if you ever go scuba diving, you may see this animal called a sea squirt. And a sea squirt has this really incredible neurological journey that's very similar to our own. So when a sea squirt is first born, its sole purpose in that first like 12 to 72 hours of its life is to find a place that it can just park itself and never have to move again. And when it's first born, it's got like a brain, it's got a spinal cord, right? And it's just mobile, it's swimming around looking for a place to park itself. Once it does that, once it latches itself to some coral or some rock, all of a sudden its body starts to release chemicals that cause its brain and spinal cord to disintegrate. And over time, it's left with this rudimentary nerve cell as its brain. We see the same sort of process happen in people. When you are sedentary, when you stop moving, your brain atrophies, right? And so being physically active is incredibly important for your neurological health.
Definitely.
Wow.
That's incredible.
That's a great analogy.
Yeah, no, that's super fascinating. I know we want to dive really deep into that with you, but before we do, tell us more about your practice today. What does your practice look like? What kind of patients are you working with? And then kind of transition us into the role of physical activity in your practice.
Sure. So I was an epilepsy specialist, an epileptologist for about 5 or 6 years in a group private practice. I was probably about 3-4 years in and was doing really, really well, and kind of looked at one of my colleagues who was senior, and I was like, is that really going to be my life when I'm, 10 years from now?
Sure.
I just felt like there was a lot more that I could do, and I actually ended up resigning like right on the spot.
Wow. Okay. I like
No
it.
plan, nothing.
Following your gut.
Yeah, good for you, for sure.
And the owner of the practice came to me and was like, look, you have so many patients in our practice that even if half your patients went with you, our practice would be devastated. So what do you want? And so I was like, well, I want the ability to create my own company. So I will still, work for you, but I want to be able to create my own company on the side. So I created the BrainFit Institute.
Okay, cool.
Where I was seeing, patients with neurological disorders. I opened up an office right next to a health spa.
Nice.
And I had worked it out with them where my patients could exercise there underneath sort of my direct and indirect supervision.
Awesome.
And based on their medical and neurological needs, I would just plan out what they needed to do. And so did that for a couple of years. And then sort of decided it was just time for me to just move on, right?
Sure.
Move on from the epilepsy practice. I just, again, felt like there was a lot more that I could do. I didn't sort of like the restrictions. And then I ended up creating an app called Dr. Douyon's BrainFit, which is a game that teaches people about how health and wellness just impacts their brain.
Cool.
And at the same time, I was writing a book. And so I released that book last year called Neuroplasticity, Your Brain's Superpower. And I still, from time to time, do see patients in the typical sense that most doctors see patients. But then just last week, I actually launched my online course, Take Charge of Your Brain in 30 Days, where I work with people with neurological and chronic medical disorders to really teach them about all the different things that impact their health, impact the health of their brain, and how they can really just kind of create the life that they want for themselves.
Very cool. Very,
Wow.
very, very
Congratulations on your launch. That's so great.
Yeah, that's amazing.
Thank you.
Very neat. Is it going well so far?
Yeah, so far it's going well. We're getting some really good reviews and really good feedback. And so I'm excited about it.
That's fantastic. Well, let's dive into the exercise piece. So, we've heard before, at least, it's something that we've discussed briefly, not in depth, but the idea that, all right, exercise is good for your brain. All right, exercise is good for, your cognitive function, your brain health and whatnot. But what does that actually mean? What role does exercise actually play in helping you have a healthier brain?
So exercise is the biggest promoter of neuroplasticity there is. What that means is it gives your brain everything it needs for your brain to make new neurons and new connections. And so we used to think that our brains were static, that we were born with a certain amount of neurons, that as we get older, we may lose some because of some degenerative process or because of some trauma.
Sure.
But we now know that that's not the case. We know that our brains are capable of making new neurons our entire lives, right?
Nice.
And so exercise gives our brains what it needs in order to be able to do that. And in fact, exercise causes our bodies to release brain-derived neurotrophic factor, which is a chemical that induces the brain to make new neurons and new connections.
That's awesome. That's really cool. So by exercising, you get that release of BDNF, which will help, like you're saying, your brain create new neurons, make new connections. And does this happen throughout our entire lives? Is it only when we're young? Does it happen even when we're elderly? Like, who is this good for?
So it's good for everybody. I mean, there are times in our lives where we've got these critical periods where we're more likely to make new neurons and new connections. So like when a baby is first born and they're sort of taking in everything, right? Their brain is just primed to make new neurons and new connections. Maybe again in toddlerhood, where they're learning to sort of walk and talk and they're exploring more, right? We see it again between the ages of 18 and 22. The brain is becoming much more specialized. So that's a time where it's making a lot of new neurons and new connections. We see it during pregnancy, right? Women's brains during pregnancy become incredibly specialized in order for them to focus on taking care of the baby. But besides those critical periods, we still have the capability to make new neurons and new connections as long as you're giving your brain what it needs, as long as you're doing the things that are going to promote that, right? And staying away from the things that are going to cause damage to the brain.
Okay.
So I think you alluded to this before, but I just want to clarify. So when we exercise, we produce chemicals that actually promote our ability to make new neurons, new connections in our brain. And when we don't exercise, you mentioned that our brain like shrinks and gets like poor quality. So it doesn't just stay static if you decide that you're not going to be an exerciser. Does it actually get worse?
So yeah, so our brains are constantly evolving for good or for bad, right?
Okay.
And if you're engaging in things that are not healthy for the brain, you're causing the dysfunction of neurons. You could potentially cause neurons to die. And so you certainly want to be engaging in the kind of activities that are going to promote new growth, new cell growth, right? And this is not something new. Our brains have evolved, are very different than they were from the early human species, right? So our brains have significantly evolved over the last couple of millions of years. And especially our brains have gotten bigger. We've increased the number of neurons and connections in our brains. And so researchers have looked back and said, look, why is it that no matter where on this planet that early humans sort of evolved to, that their brains all got bigger?
Yeah.
And so there was a researcher out of Harvard who wrote an article in the journal Nature back in 2004. And so this process of when your brain gets bigger, we call it encephalization.
Okay.
And what they found was that the reason that our brains got bigger and created more neurons and new connections was because of our need to run long distances, right?
Whoa, that's cool.
From an evolutionary perspective, early humans had to chase down their food, right?
Sure.
They had to run away from predators, right? And so they were constantly moving. And so this triggered the encephalization process.
Wow.
And so when we think about our brains today, right? I mean, our bodies are sort of built to move, right? We're built to run, jump, dance, skip, all types of movements, right? Controlling all of that is our brain.
Wow.
Sure. Yeah.
When you said this, I'm going to mess it up. Encephalization.
Yeah.
When you said that, I thought you were going to say like, well, of course it's going to be because, we've become brainiacs, like we're going to education, we're in college, we're solving problems. But you just said that our brains had to physically get bigger so that we can move more. That is fascinating. That's crazy.
That's really cool.
And I grew up in that era where it was kind of like dumb jocks, right?
Sure, right?
Like that is not the case at all. Like give me a jock any day over somebody who just sits down all day long.
Sure, yeah.
Because their brains are primed to learn. And we see that with our star athletes, right? I mean, I'm sort of partial to tennis. So you look at tennis players speak multiple languages. It's not like they spend an entire year in one country, right? Whether you're looking at Roger Federer, Serena Williams, like they're polyglots. They speak like 3-4 different languages. You know, they'll be in Rome this week. They win a tournament. They deliver their speech in Italian. They go to Paris next week. They win a tournament. They deliver their speech in French. You know, it's incredible.
Yeah.
You see with our basketball players who, you know, are not just successful on the court, but are doing amazing things off the court.
Definitely. Definitely. No, that's really cool. Well, it's really interesting that you bring up the idea of running long distances, you know, because one thing that I heard in grad school was that, you know, relative to animals that we might like eat or try to hunt, like our bodies are much better suited for doing kind of longer distance stuff. You know, we're able to sweat. We have relative to other animals, very little body hair, so we're able to dissipate heat. So our bodies are definitely built to do kind of longer endurance stuff relative to other animals. It's really cool though, the point that you brought up about the brain needed to adapt in order to allow us to do that. That's just so fascinating.
Yeah, and when you think about how people, or a lot of people, spend their lives today, you know, sort of knowing how our brains and bodies have evolved, it's completely different than what our brains and bodies are meant to do, right? I mean, people are just sitting down all day long. A lot of times somebody will come to my office, you know, let's say somebody comes and they're having some memory problems. And I'm like, well, what do you spend your days doing? They're like, nothing, just sitting down watching TV. I'm like, so what did you think was going to happen?
Sure, right? Yeah, no, it's a great point. It's a great point. Okay, so then when it comes to exercise, is it, you know, strictly kind of aerobic endurance exercise that people should be focusing on? Or, you know, what about things, well, let's talk to that benefit first, and then we can kind of go down the avenue of like, well, what about other things like maybe high intensity stuff or resistance training or things like that. But let's talk the endurance aerobic piece first.
Yeah, so, you know, ideally, you really want people to combine aerobic activity as well as resistance training.
Okay.
In an ideal setting, it's not just those two things. You want there to be mobility training, right? You want them to increase their range of motion. You want them to be doing things that are important for coordination.
Sure.
And exercise, I'm a big believer that exercise needs to be part of any therapeutic regimen. And so, you know, when we think about people who have had a stroke, a lot of times if they're weak or paralyzed on one side, they'll stop using that side completely. And it's like you're essentially telling your brain you don't need it anymore.
Sure.
And what you need to be doing is still exercising that weak side, because then that's going to allow your brain to reorganize and make new connections. And your brain is capable of doing this months and years after there's been a trauma. Right?
Wow.
We see somebody with Parkinson's. Parkinson's, you know, you've got decreased dopamine in certain parts of the brain. Right? Well, you need to exercise so that way you can stimulate the brain to make new neurons that make dopamine. Right? And so you see things like shadow boxing becoming a really important part of the therapeutic process for Parkinson's. So it's really important, I think, to combine all facets of exercise, not just do one.
Awesome. Very cool. Very cool. And then, so everything needs to be included from, you know, your moving throughout your day, your lower intensity stuff, maybe more moderate intensity running and jogging. And then what about like the higher intensity stuff? You know, you talked about resistance training. What about like sprint type work or things like, is there kind of brain benefits to doing the higher intensity stuff?
Yeah, so one, it's a different kind of challenge, and you always need to be challenging your brain, right? Your brain gets used to what you're doing the same way that your muscles do, right? I mean, if you're just doing bicep curls all the time, you're not going to see the same kind of results that you did in the beginning. And so doing the high intensity, especially interval training, is really important as just a challenge, you know? And studies do show that when you're doing, when you're incorporating that, your levels of brain-derived neurotrophic factor tend to be elevated.
Awesome.
And I don't know if we can explain why that's so different than if you're just doing aerobic training. But yeah, the studies show that you get higher levels.
That's really cool. That's really cool.
So I have a question. So Charlie and I, we're trainers. We do something called muscle activation. So people come to us and usually they have something going on in their body that's telling them like, I probably should, do something muscle wise to work on this, meaning they feel like weak or they feel there's something not functioning well, like their shoulder's not functioning well, so they reach out to us, rarely, I don't think we've ever gotten a phone call saying like, I'd like to work on my brain health, and come in. So what would be signs and symptoms that tell someone that, your brain function is decreasing? You probably should do some lifestyle related things to help you start improving this, because I think we can easily identify like other factors that are telling us like that we're sitting on our butts too long, things like being chronically achy or, getting belly fat or, losing muscle mass or losing strength. I think a lot of people will associate that with lack of exercise, but what are some like brain symptoms? I don't know if that's what you would call it, that people might start seeing in themselves and are like, dang, I need to change my lifestyle here.
So that's a great question. And so it's things like having memory problems, right? Having difficulty focusing and concentrating, having difficulty sleeping, frequent headaches. And in fact, most neurological disorders, if you increase your level of physical activity, you'll see an improvement in your symptoms.
Wow.
From epilepsy, there are people that I take care of who have had epilepsy their entire lives. And we get better results changing their diet and putting them on an exercise regimen than we do when they're on 5 different medications.
Wow.
And we talked a little bit about strokes and Parkinson's. The only thing where people really have to be a little bit more careful with is something like multiple sclerosis. So when somebody has multiple sclerosis, it's because the wrapping around the axons of your nerve cells, of your neurons, right? And that wrapping that's there allows for neurons to communicate very quickly with each other. And in multiple sclerosis, that wrapping starts to break down. So that wrapping is called myelin. In multiple sclerosis, it demyelinates. And what we know is that when our body heat goes up, just in general, for most people, that their neurons, sort of the way that the electrical signal travels from one neuron to the other slows down significantly. Just in somebody who's has no neurological issues. And so when you add that to somebody with MS, then that can trigger their symptoms.
Sure.
So you really want to be sort of careful there. But exercise is still important there because it does help to strengthen their muscles. It does help to alleviate a lot of the tightness that they get. It helps to alleviate a lot of the spasms that they get. So, there are neurological symptoms that you'll see in people where you're like, listen, you need to exercise. And I have that conversation often with people. Right? And in fact, studies do show that if somebody's starting to develop some cognitive issues, you'll see an improvement with their cognitive function if they start to exercise 30 to 45 minutes a day. And it doesn't even have to be intense. It could just be like moderate intensity walking.
Awesome.
Yeah, wow.
Awesome. Okay, cool.
At what age would you say like this normally happens for like a normal neurologically functioning person? They don't have a diagnosed ill condition. And is it usually only in older people, or do you see it a little younger than you think? Because I think we see like muscle issues and muscle atrophy and muscle dysfunction a lot earlier than people think that it should be.
Yeah, no, you can see it at any age. And in fact, what we do know is the way that you treat your body at 20, 30, 40 impacts, your body and brain health at 50, 60, 70, 80. But certainly, we see it in kids, right? Because you've got kids now that are real sedentary. They just sit down in front of a computer or play video games. They have difficulty focusing and concentrating. They get all types of labels and diagnosis, right? Whether it's ADD, ADHD. And in fact, if you can put those kids or even adults with ADHD on a really good exercise program, you'll see a benefit in their symptoms.
Oh, yeah. Wow. That's awesome. That's awesome.
I think just the other day, I was telling Charlie that, when our kids get older and they go to school, wouldn't it be so cool if we could find a school that starts at like 9 or 10 a.m. That way, like we could do like a family workout, we wake up, have breakfast, do a family workout, and then they can go to school. Like how much better would their day be if they just had like all this movement. But when you think about kids, I know you just brought up kids, so that's why I was thinking about this. We actually have a toddler. She literally moves all day. She does not stop. But then there becomes an age where we think that it's like a good idea to have them like sit still all day, except for 1 hour of recess or whatever they get, 30 minutes of recess. And that just blows my mind that that's an appropriate change, from this like exploring human that needs to touch everything. And I'm sure that if we allowed 8-year-olds just to explore all day, that's what they would do. They wouldn't decide to like sit there.
Exactly.
Yeah. Look, I tell people all the time, well, I used to tell them that you need to act like you're 20, right? If they're 40, 50, 60, 70, I'm like, you need to act like you're 20. You need to go and explore the world and do whatever. Now I'm like, you need to act like you're 2, right? Because 3-year-olds, like you said, they're all over the place. They're constantly moving. They're constantly exploring. And what is it that we say about toddlers? We say their capacity to learn a second language is far greater than that of adults.
Sure.
But why is that? They're constantly moving and exploring. They're giving their brains everything that their brains need to learn and pick up languages efficiently. Adults aren't doing anything but sitting all day.
Yeah. No, it's so true. It's so true.
And I don't know if you guys have ever read the book Spark.
Yeah, great book.
Yeah, so in there they describe a study where if, how when you're in school, like just cramming to the very last minute before we have to take a test. And they showed that, look, if kids, instead of cramming, go out for a run an hour before the test, they're more likely to do better on the test.
Wow, how cool is that?
More to get the answers right more often than not.
Huh. That's so cool.
That's awesome.
That's really cool. Okay, so we talked about BDNF, and like that's all fine and well, but what I'm curious is, does the increase in BDNF actually translate into like noticeable differences with people's memory, with people's verbal skills, with people's cognitive function? Like, do we see an objective change in people's brain function, or is it just like, okay, yeah, there's more BDNF, okay, in theory you should make more neurons and get more synaptic connections, but like, is the brain actually doing stuff with it?
Yeah, so in theory they should be getting more neurons and more connections, but it really depends on what they're doing, right? I mean,
okay, cool,
because they need to be constantly learning, right?
Sure.
They need to be developing themselves in different ways. They need to be challenging themselves in different ways. But if you're just like kind of going out for a run and then you don't do anything with the rest of your day, it's probably great. Your BDNF levels will be high, but that doesn't mean that you're teaching your brain anything.
Sure.
Yeah.
It's hard to learn something if you're not really trying to learn anything, right? So to your point, yeah, if you just go for a run and then you just kind of sit around all day in a blank room, you're not going to get much from that. But if you go for a run and then maybe, you read or you're exploring or something like that, now your brain is primed for that activity and maybe you're able to get more from it. That makes sense.
Absolutely. And when you look at some of the most successful people on this planet, they all do a really great job taking care of their bodies. You may consider them some of the smartest people, yet they make sure they devote time to their day to developing their bodies in some way.
Yes, that's awesome. That's so true. That's so true. So now we have BDNF. Are there other neurochemicals, other proteins, other hormones that are increased that help the brain function better? I guess BDNF probably takes care of the growth part, but at least help the brain function better from exercise.
Yeah, so I mean, you've got things like vascular endothelial growth factor, which goes up, which allows your body and your brain to increase the blood flow, which is really important, brings more nutrients and connections. You have things like dopamine levels that go up, and while dopamine impacts a lot of different things in the body, right? When dopamine levels go up really, really high, that can lead to psychosis. It can lead to addiction. When it drops, we associate it with Parkinson's. What it really does do is that it plays a huge role in motivation. And if you want somebody to create a habit, that takes place because of dopamine. And exercise helps to boost up those dopamine levels, which is part of the reason why some people will get a high after they exercise.
Sure.
I mean, it may not increase it to the level of something like cocaine,
right?
or some other illicit drug. But you do get a high. So a lot of different factors go up with exercise.
Okay.
But also you've got some of the things that are some of the chemicals that sort of in the short term are really good for your body, but in the long term are really bad for your body.
Okay.
Exercise helps to decrease those and regulate those as well.
Oh, cool. Very cool. Very cool. All right. Talk to us more about the VEGF, the vascular endothelial growth factor. You said that that's to help the body and the brain kind of build new blood vessels. Is that what you're saying? Okay.
Yeah. So when you see people who are working out all the time and they got tons of
Right. Yeah.
they're making a lot of vascular endothelial growth factor.
There you go.
And so when you've got a lot of blood vessels, that means that one, you're diverting blood flow, right? So you're decreasing blood pressure, which is really, really healthy.
Sure.
You're bringing more nutrients, more oxygen to your muscles, to your cells, to your tissues, right? You aid in recovery, which is really healthy. So vascular endothelial growth factor is really great for the entire body.
Awesome. So we work out, we get our BDNF boost, helping our brain to develop new neurons, new synaptic connections. We get our boost in VEGF, which is going to get more blood flowing to our brain.
And the dopamine.
So now our
we're feeling good.
Yeah, our motivation is higher, and that's probably also plays into why we see when people exercise, they tend to make healthier decisions or more decisions that are consistent with a healthier lifestyle when they're exercising consistently, because maybe their motivation is higher, their willpower might be a little bit higher to, not reach for the sweets and treats or something like that. They have a little bit more motivation to kind of stick with their goals. That's awesome. That's really powerful.
And dopaminergic neurons send connections to your frontal lobe, which is responsible for, your decision-making capacity.
Okay.
If you're getting a high from exercising, your brain and body always wants to chase that high. And so it's going to motivate you to engage in the behaviors that are going to get it that high that it was getting before from whatever exercise you just did. So you're more likely to continue it. And that's how you build habit. It's also the way that you build addiction, right? And you will often see people who had an addiction in something like, whether it's drugs or alcohol, that what they end up doing is swapping that addiction for a healthier addiction in exercise, right?
Okay, yeah, definitely.
All right, I don't know about you guys, but I feel like we just created like the best sales pitch for exercise.
Exactly.
I mean, this is the sales pitch no one hears. I mean, we hear about exercise like, oh, it makes you like feel good and stronger and better posture, but we don't really, obviously ever talk about the brain health. At least it's just way less common.
Yeah.
But what are some of like, when you talk to people through your program or through your patients, why are people not exercising? I'm still trying to understand, like, why aren't people doing this? Like, what are the excuses or the pushbacks that you get often?
Well, often you'll get things like, they don't have time, or we've done a really great job in our society, and medicine has a lot to blame for this, on selling people on, you can do whatever you want to your body, and there's always going to be a pill there that's somehow going to rescue you. And the reality is that the vast majority of medications manage symptoms, at best without side effects, but they don't really do anything for the underlying issue.
Sure.
If you want to really get yourself healthy, it's really about the work that you need to put into it, right? And that includes exercise, that includes eating healthy, that includes getting enough sleep, that includes minimizing stress, that includes making sure that you're constantly learning. So it's about taking responsibility for your entire life and your health. And a lot of times people just want to pop that pill. They just want that quick and easy fix.
Right.
No, and that's the reality is that's where a lot of money is made in medicine.
Yeah. I know when people start with us, there are people that start and they're like, well, I know I need to exercise for the rest of my life. So I'm just here twice a week. I'm here. And some people come in like, so like, how long is this going to take? I'm like, oh, how long do you plan to live? That long. That's how long it's going to take, because you got to keep moving.
Yeah.
Got to keep moving.
Yeah. You got to keep moving. And, if you want to plan to keep moving in any capacity, it's like, we have to practice that. You have to keep challenging that thing.
Yeah.
So that's really interesting.
Look, I tell people all the time, like, you don't necessarily have to go to a gym if you're not a gym person.
Sure.
But get your body moving. I don't care if you love dancing, find a way to dance 3, 4, 5 times a week at moderate intensity. Just get your body moving.
Yep,
We
exactly.
actually just did a podcast. We recorded one earlier today, and one of the things that we talked about were exercise tools. And one thing that I think a lot of people that don't like the gym, they just kind of push it off and they're like, yeah, I don't like the gym, I'm not a gym person. But one of the great benefits of a gym is that gyms have a lot of tools to use. Like they have a lot of options, way more options than you have at your house or outside. And so I think that even if you're not like a gym buff, gym rat kind of person, it's like there's still like so much variation that's just available there and easy to access, for $10 to $50 a month.
Right.
Yeah. No, easy access to a lot of different equipment, a lot of different classes, people around to motivate you.
For sure.
So it's a really great tool.
Definitely.
And I was just telling somebody today, with the pandemic and gyms being closed, at least in New York, you're just like, damn,
right?
I have nothing. I have no tools.
Yeah.
At some point, you get tired of all the body weights.
Exactly.
I know.
Our studio was shut down for 10 weeks from kind of mid-March to the end of May. And I could not wait to get back to be able to use our machines and use our equipment because, we were working out here every day, but it's like, I need those machines. I need something new. I need to get back to that. So I hear you on that.
Like I need to feel a real weight.
Exactly. Exactly.
Well, people forget just the health benefits that come, especially, we look at it in the muscle system a lot, but just from actually challenging the system. Like some people come in, they're like, yes, I exercise, I walk. And I'm like, okay, that's awesome. That is like that's like step 1. Okay, we got to do go up to step 1,000. There's a lot more benefits from exercise that you can be doing. Walking, I'm so glad you're doing that over doing nothing, but we got to be doing a lot more, and you'll be getting so much more health benefits if you do more than just a walk.
Exactly.
So early on in my career, I sort of accepted the walking.
Okay.
Over the last few years, depending on your age and what you've got going on health-wise. But if you're somebody who is able-bodied and you're fairly healthy, I'm like, all you're telling me is that your legs work. Right. That's all you're telling me. And that's great, but you really do need to challenge yourself a lot more.
Exactly.
When we went to a talk by a doctor this past year, and someone, of course, at the end raised their hand and said, is walking truly the best exercise? And I think we actually talked about this on another podcast because I was so infuriated by it. He was like, in fact, yes, it is. And I thought, oh my gosh. But to his defense, he is recommending it to a lot of people that he knows nothing about their exercise history. So most people can walk. So that's good.
Sure.
But they need to be doing a lot more than that.
You need to be doing a lot more. And so I used to teach tennis. And I used to teach tennis to even people who were paraplegics and quadriplegics. Right? From the quadriplegics, we'd have to tape the racket to their hand.
Sure. Okay.
So they were getting really great exercise, right? So if you are able-bodied, the walking just doesn't cut it.
Right? Exactly.
You know what? So many more people are able-bodied than they would put themselves capable of. Like, I think so many people, maybe they haven't worked out ever. Now they're 60, they have a few chronic ailments, their hip hurts. And then they start labeling themselves as, well, I can't do that. Well, actually, you can. It needs to be appropriate for your body, but there are so many things you can do. But you probably can't do what you used to do when you were 20. But let's try to work towards that. It's steps to get there. So I always feel like people can do way more than they think they can. They're just unaware because they haven't done it before, or it's been years.
Exactly.
And to your point, so I talk about this in my course, do we do a disservice by giving people a diagnosis? Because then what people do is they try to live up to that label, right? So if I say to somebody, let's just take the type 2 diabetes as an example. If I say, you've got type 2 diabetes, then they look up and they're like, what is a type 2 diabetes person sort of, what are they like?
Exactly.
Kind of like, okay, well, I guess that's who I am, right? And so they don't exercise and they don't eat healthy. They don't get enough sleep. And so people have to sort of evolve past whatever labels it is that we give them.
Yeah.
That's such a great point. I think one that we hear a lot is like herniated discs.
Oh, for sure.
And people are like, well, I have a herniated disc. Of course my back's going to hurt. And I was like, well, what if we could strengthen your back so much that you're unaware of it, and then you wouldn't have ever gotten that diagnosis? Because I don't know, this random statistic, which, Google says is right, but who knows? But, I'm sure there's things out there like this, but it says like 80% of people over the age of 30 have a herniated disc. We just don't know it, and so we're not 80% of people over 30 are operating under the idea that we have a herniated disc.
Right.
Yeah. We just try to manage and be the healthiest we can instead of being like, let me do things that herniated disc people do.
Exactly.
And then we start having all these limits on ourselves.
Yeah, and when you have a herniated disc, actually the best thing to do is exercise, because you have to strengthen your core being your abdomen, your lower back, your hips, your groin area, to help pull that disc back into place.
For sure.
So a lot of times people will do some physical therapy. And physical therapy, I always tell people, it's fine. It's a great place to start. Sometimes I do feel like it's a little too passive, especially as somebody gets a little bit more advanced in terms of their exercise regimen.
Sure.
But you've got to strengthen your core. That's the only way you're going to get those discs back into place. And even if somebody needed surgery, nobody gets better if they're not exercising and strengthening their lower back and their groin area.
For sure.
All right. I have a question about a classic brain strengthening activity.
Okay.
Is sitting there doing Sudoku every day help your brain get better? I'm
So,
wondering, because that's like the ultimate of like,
so I don't think so. However, I don't think so. But I do think that you do need to challenge your brain. And so you want to challenge your brain by learning new languages, by learning new instruments, by having conversations with people who don't think like you. It doesn't mean that you have to, take their opinion and adopt it. But their perspective is unique and allows your brain to make new neurons and new connections. You want to travel to different parts of the world. The reality is that, how we say people are creatures of habit. Being a creature of habit is killing us neurologically. We want new experiences all the time.
Yeah. Wow.
So I would assume and jump to this that doing new things would also include like new things with movement and exercise. I
Absolutely.
think to that, but I noticed that like when I train people, I'm always trying to do like, let's try a new like footwork and see how you do with it. And day 1 they're moving like a snail,
right.
And day 10 they're smashing it, and then they're like, man, Julie, don't give me a new one. I'm bad at it. I'm like, well, that's the whole point. I want you to be bad at it so we can build it up. And a year later we'll come back to it. Now, after we've taken a break, you'll be bad at it again, and we'll practice it again.
Right, and that's the thing that you see with let's say sports, for example, right? When you first start, you suck.
Right? No, for sure.
You can't coordinate the movements. Like, you don't know where your foot is supposed to go. You don't know how to dribble a ball. You don't know how to swing a racket. Like, you just don't know how to do those things. And with practice, you get better. And people always say, it's muscle memory. It actually isn't muscle memory. It's because your brain is creating networks of neurons and connections around that particular activity. And the more you do it, the stronger those networks get. And as a result, you don't have to think about it as much, and it comes much more naturally to you.
Yes.
So, but doing that stuff is so important.
That's awesome. So what should people be doing? Like, if you were going to give a general exercise recommendation for, somebody who's able-bodied, maybe not super fit, but can definitely exercise without too many issues, and they're hearing this and they want to start improving their brain function, what would you say would be a good starting place, and then maybe something to aim for?
So I think it depends on what the person has an interest in, but I'm also a big believer in surrounding yourself with sort of experts, people that will hold you accountable, people that can challenge you in different ways. I've done I've had my personal trainers, I've done group classes, right? Because you don't know everything, and you don't know, people have different perspectives. People see your movements. I may think I'm squatting perfectly. Right, and somebody might be like, no, you've got to stick your butt out more, you've got to stick your butt out less, or something, right?
Right.
And so I think having somebody who can do a really great assessment is always really important, right? And make sure that your form is good, that you're not injuring yourself. But look, getting yourself moving is better than not moving at all. And
Sure.
so finding something that you really enjoy doing, whether it's a sport, whether swimming is a great exercise if you've got access to a pool. Running is great, but depends on where you're going to be running and what your joints are like. So,
but would you say, maybe like going out for 20 minutes a day, from a volume perspective, like what would be an aim for, a workout? Earlier, I thought you said maybe like 30 to 45 minutes a day. Like, is that kind of a good starting place or a starting goal to get to?
Yeah, so I think what the recommendations are, and these always change, but about 150 minutes per week of aerobic activity.
Okay.
And it's a little bit less of resistance training is what's recommended. But this stuff always changes, and it really depends on the person, right? So somebody who is morbidly obese and they're first starting out, your recommendation is going to be very different for that person as opposed to somebody who's maybe in halfway decent shape and can do a little bit more.
Definitely. Yeah. No, that makes sense. Totally.
I love that you said that. One of the things that Charlie and I work with at our facility a lot are, muscle rooted issues. And so often we'll have people come in and be like, well, I know like the recommendation or I want to improve my heart, so I got to do the 150, minutes a week of this. Mm-hmm. And it's almost like, okay, well, your body can't break down as you're doing that. So I love that you brought up, well, it needs to like match the person that it's coming from.
Yeah.
Because I think one thing, especially, I'm going to blame this on doctors, but they give such generalized recommendations sometimes that, we'll get someone in with, even a chronic disease and they'll be like, well, my doctor said I need to do this. Mm-hmm. And it's like, oh, wow, that can be interpreted in so many different ways. That's not very specific at all.
Right.
Yeah, no, I mean, in medicine, we've got like standard of care, right? And standard of care is good and bad. Mm-hmm. One, in theory, it says, look, everybody should get a certain level of care. But the reality is that you've got to individualize this stuff, right? And while it may be sort of give you a guideline, everybody is different. They're going to be, we see it with medications. You give somebody one medication, they're fine. You give somebody else the same exact thing and you almost like kill them.
Right.
And so you've got to be very, very careful with sort of the general advices that you give. And what I tell people all the time is, look, I might be an expert on the brain, but you are the expert on your body and your brain. And so, the way that I look at it, it's two experts coming together to try to figure out the best way to solve whatever health issue that you're having.
Sure.
But ideally, you want to involve as many experts as possible, right? And I do this often. So whether it is therapists or trainers or mental health experts, to really give that person a really good support group.
Mm-hmm. Yeah, definitely. So along those lines, we're curious, what do you do to kind of maintain and build your own health and function throughout your day and throughout your week?
Yeah, so it's been a lot of body weight stuff.
Sure.
This morning, so I try to get a workout in the mornings. And so this morning it included 100 push-ups, 100 squats, and those were air squats. And then I had access to some dumbbells. So did some biceps curls and squatting with the dumbbells. Tomorrow morning, I will probably go for a run. And I live in New York City and there's scaffolding everywhere.
Okay.
So what I do is then use the scaffolding to do like pull-ups, chin-ups.
Perfect. Yeah.
And then there's a place where it's got some boulders that is kind of like evened out though.
Okay.
So I'll do some box jumps on that.
Sweet.
So it depends on what I've got available, but I am missing the weights.
Sure.
Usually every morning you're doing some kind of movement, workout in your house, out of your house, at the gym when it's available.
Right. Yeah.
That's great.
I think it's a really important way to start your day, just to get your body moving.
Definitely. Do you find that you feel kind of like mentally sharper, more with it throughout your day versus if there's ever a day when, let's say you have to catch an early flight or whatever, you just can't get it in, you have to miss. Do you notice a change in your own function?
Yeah. So one of the things that I always notice is that if I don't work out for a few days, my body feels sore. But not in a good way. Not like you did something. You're just like, what is going on? Am I getting old? Like, why is my body hurting? right? So then I'm kind of like, listen, if I'm going to be hurting anyway, I want to be hurting because I did something.
Right?
Um,
Exactly.
but yeah, I'm primed to sort of learn,
Mhm.
when I'm exercising. I'm a lot more mentally sharp, mentally with it, especially on those long days. I tend to have a lot more energy when I get a workout in. So for me, it's really important.
That's awesome. Dr. Douyon, talk to us about your book. Tell us about your book. Tell us about your online courses that you've launched. I want to know more about those, and how can our listeners learn more about those?
Yeah, so the book is called Neuroplasticity, Your Brain's Superpower. And it talks to how our brains are constantly evolving, how our brains are capable of adapting, learning, healing after injury. And so that's available on Amazon as well as Barnes and Nobles.
Awesome.
And then the course is called Take Charge of Your Brain in 30 Days.
Mhm.
And so the way that the course is broken down, it's more than 70 lessons spread across 4 modules. The first module is about the importance of having a mission, vision, and purpose despite whatever your diagnosis is, and how that's important for the brain's evolution. The second module really talks to about preventable chronic diseases and how those impact the brain. The third module is about teaching people to have a completely different relationship with their brain,
Okay.
becoming the leader that their brain needs them to be. And it also teaches them about neurological disorders. And then the fourth module teaches them how to create their own prescription plan, one that's rooted in the development of their mind, body, and soul.
Awesome.
And so, yeah, as part of the course, they end up getting sort of this digital planner journal that I've created to help them along the way.
Great.
Depending on which package that they sign up for, if they sign up for the premium package, they get 2 hours of group coaching with me every week.
Nice.
And even though the course is called Take Charge of Your Brain in 30 Days, they do get access to the course for a full year.
Oh, sweet.
Yeah.
Sweet. And are there specific start times? Like it starts the first of every month, or is it a rolling enrollment?
So it's a rolling enrollment. And so in terms of the live group coaching, so let's say Mondays, what we do is we go over content.
Mm-hmm.
Right? And so the first Monday of the month, we'll go over the content from module 1. Mm-hmm. And then the Thursdays is a live question and answer session.
Awesome.
Who is this course targeted to? Like when you think about this course, if you were like, this would be perfect, the number one most perfect thing in this kind of person's hands, who would it be?
So it's people who've got neurological disorders and chronic medical issues. If you're the kind of person who just wants to pop a pill, this is not the course for you.
Sure.
Right? Because this is really about teaching you and empowering you so that way you can go out there and do the work to really get healthy, and then also create the life that you've always wanted. Because so often what I see is that people with medical issues, they hold themselves back, right? Their identity becomes wrapped around this medical issue.
Sure.
And what I know is both as a physician, but also as a patient. I've been a patient more than half my life, right? Much longer than I've been a physician. But I've never let my diagnosis just sort of take over my entire life. It's part of my story, but there are a lot of different parts to my story. And so I've been able to use it as a strength. And so it's about teaching people how they can do that for themselves as well.
That's awesome. So where can people learn more about this course? Is there a website for it?
Yeah, so they can go to my website, Inle BrainFit Institute.com. So INLE Institute.com.
Awesome.
And the course is called Take Charge of Your Brain in 30 Days.
Cool.
They can go to my Instagram, Facebook. They can look me up there and they'll find information about the course.
Perfect. So we'll link to all of those in the show notes. Now, is there anything that we haven't asked you that we should have asked you about your area of expertise?
Oh, I mean, sleep is made for the brain.
Okay.
I mean, chronic stress is horrible for the brain.
All right.
Yeah. So, I mean, look, we can talk about this stuff for days, right?
Right. Those sounds like 2 encore episodes
like
right there.
Next episodes.
Exactly.
Right?
Yeah, definitely. We'll have to get that set up. No, that's super fascinating. I definitely want to dive into those topics with you. Well, the question that we like wrapping up with for all of our guests is, Dr. Douyon, what is your definition of health?
Oh my gosh, my definition of health. So it's not just the absence of disease. Like you actually have to be prioritizing taking good care of yourself your entire life, because whether it's our brains or other organs, they have this sort of really high tolerance in terms of dysfunction, right? So you've got organs that you could be completely feeling great and you're losing 60-70% of that organ before you even ever develop a symptom.
Wow.
And you don't know that's occurring, right? And so even the brain has really great reserve. I mean, I see people all the time who they're like, yeah, I was fine, or my mom was fine, and then all of a sudden she got a UTI and now her memory is completely gone. You know, like she's got like Alzheimer's.
Yeah.
Well, this is not something that happened overnight.
Sure.
Her brain has been damaged for 20 years, right? It's just that the brain has such great reserve that you didn't know, and now this little thing sort of pushed her over.
Sure.
And so you've got to be working on keeping yourself healthy. You've got to put the work in. So it's not just like, oh, I feel great, I don't have a diagnosis. Like you actually have to be doing the work.
Sure. I love it. Yeah.
And you brought up so many good points on like how to get that done, whether it's finding something you enjoy, you know, and I think a lot of people use trainers. If they just don't enjoy it, at least they can socialize with someone and do it. That works out.
Exactly.
Yeah. Well, you don't have to think about what you have to do, right? Somebody's telling you what to do. You don't have to come up with your own plan.
Yeah.
Wow, this has been one of my favorite podcasts.
This was fascinating.
I appreciate you letting us pick your brain on all this.
This was great. Thank you so much for sharing your time, for sharing your expertise. It was really a joy talking with you this evening.
Thank you guys. Thank you for having me. This was fun.
Don't forget, you already brought up the next podcast topic.
Exactly.
So.
Sleep and stress. Yeah, absolutely.
For sure.
Wow, was that a powerful episode or what? I mean, look, if you are looking to improve your brain, like Dr. Douyon was saying, there's literally nothing better that you can do than be exercising on a consistent basis. So who do you know that needs to hear this episode? Who do you know that is interested in improving the health and function of their brain and is looking to do so through very easy conventional means such as exercise? Share this episode with them so they can learn of the amazing potential of exercise to improve the health and function of their brain. And while you're online, if you wouldn't mind, head on over to iTunes and leave us a rating and review. It helps people find this podcast when they're looking for information on exercise and when they're looking for information on health. So if you found value in this conversation today, let us know by leaving us that 5-star rating and review. Well, thanks so much for tuning in. We always appreciate it. Have a fantastic week, and we'll talk with you all next week.